All right, so I think I told both of our speakers that we are 33 years old. We started out as a research organization in New York City. And then Bob Gibbia, is Bob here? I know Paul has met Bob. Bob was on C-SPAN this morning with Patrick Kennedy to announce the launch of the new Mental Health for Us campaign. And it's essentially going to be a campaign to educate all of the 2020 presidential candidates in all the major parties around mental health and suicide prevention. So it was really cool. NBC News was here. So hopefully you'll both agree that mental health and suicide prevention is perhaps finally getting some traction. Many of you from New York State know about Paul Tonko's long time championing of mental health and suicide prevention. He was... Thank you. Paul, why don't you start off and just tell us quickly about Timothy's Law and,
Sure.
and how that started your career in mental health and how it's been transformed into what you're doing today in that.
Right. You know, so many times, John, by the way, thank you for this opportunity. It's great to join Charles and you and be able to share thoughts about what's happening on the Hill or what needs to happen on the Hill, but never imagined that I would be so deeply invested in public health policy as it relates to mental health, mental illness, mental health disorders, and suicide prevention and the like. But it's not unfamiliar for us to be seen at Little League openers around our districts in the country. And there was a Little Leaguer who just was a fun little guy, and his whole team was wonderful. But I became more aware of what Timothy faced in life. He had been triply diagnosed, and so knew him, his mom and dad, and everything through the Little League kickoffs in the spring, and began to hear that he would do okay when he had the limits for inpatient, outpatient visits, but when those were eroded, life started to fall apart for him. And unfortunately, at the age of 12, I believe, Timothy completed suicide, as his parents taught me to say. And I wanted to help them because we had such a good partnership and friendship going. And I said, look, whatever I can do. And they showed up asking if we could get involved with Parity and to do it in Timothy's name and in his memory. And it was pretty tough to walk through the scrapbook that they carried with them, a rather thick scrapbook that began with him coming home from the hospital as a toddler, as a newborn, and ending with a Christmas tree on his gravesite. Tough stuff to deal with. But his parents were willing to keep reopening those wounds so that they could make a difference for everyone else. They didn't want any family to have a youngster go through those critical moments where they were denied care and then tragedy happens. I tell you, there were some tough struggles in the New York State Legislature for years. I mean years. We would have the mental health advocates at the outside of the Capitol, sometimes past midnight, asking if there was any progress. And it was always a shameful feeling to have to tell them we're not getting anywhere. And we had proposals coming from the other house on the Hill in Albany that addressed 11 different illnesses and disorders. I'm saying, well, wait, we're not clinicians. We're supposed to fight for policy that provides access and affordability and let the clinicians do their thing. But some people didn't see it that way. And I sat with the family as they were talked to from the Senate floor, looking up at the balcony in the House and saying this was the best we could do. And not ashamed to say that I tried to figure out certain ways to turn this into a litmus test in the most recent campaign of that year. And we scored. We scored big victories. We targeted districts. People had to commit to parity in Timothy's name. And I think after 7 or 8 years worth of struggle, we were able to achieve mental health parity, the first such outcome by any state capital, and even preceded the national effort that Patrick Kennedy and his dad were so vigorously working toward. So that got me onto a journey that since then has just been an emotional roller coaster, one with great passion, one with the staunchest advocates I've ever asked to meet, people who really care so deeply and so passionately that it was a blessing in disguise. Unfortunately, came with a note of tragedy. But Jeff Morgan is with us today, sitting in the corner there, who's our legislative director. And before he became director, he had worked on on health issues. And I said, look, here's some work that I want to do on mental health, because my journey began at the state assembly level, and I ran with the efforts for a number of things, a couple of priorities I established, but one, making certain that people who are impacted by our stepchilding mental health and all the associated dynamics that go with that, I said I want to make a difference and make certain that people are empowered by good policy. And I forewarned him that if you delve into this, it's going to overwhelm you. And I think he agrees today, but we both feel blessed to have been able to move some grains of sand to be able to make life better, and we're going to continue to do that. And I appreciate the partnership in this room. It is splendid, and I just wish you well as you go forward, as we go forward together to make a difference.
Well, thanks, Paul. So our other guest speaker today,
Thank you.
Our other guest speaker is a former congressman from Louisiana. He's a heart surgeon by training. You served several terms representing which district in Louisiana?
6 terms representing the coastal part of Louisiana,
Right.
from the Texas border to just southwest of New Orleans. Lafayette, Louisiana is my home.
Right, and then you ran for the Senate and didn't quite get the gold ring, but you decided to stay in D.C. in public service. And you're going to be here today to talk a little bit about the work you're doing with Senator Cassidy from Louisiana,
Right.
and Senator Murphy from Connecticut around the new mental health parity bill that's being introduced. The other 2 things I wanted both of you to know, that this is being live cast right now. So whereas we have 300 people here face-to-face, we have almost 1,000 people watching different parts of the program. So we may, in fact, get questions from those people watching from that part. And then they've committed to sending out 2 emails to each of their senators tonight.
Excellent.
And to their representatives to say, I can't be here in D.C. tomorrow, but I have colleagues who are going to be here, and we would like you to welcome them and to treat them as if I'm visiting myself. So with that, and the other thing, we're obviously nonpartisan. We have a big tent. We have people that support President Trump, and we have people that support Bernie Sanders, and everybody in between. And our mission is to make sure that no matter who is in office, that you all have the best information possible. We just hired a government relations firm to help us out on the appropriation side, and their message was make it a personal story. We have packets put together, so your staff, your former staff would get information from us, but we really want them to create a personal connection and put a face on mental health.
There's no question that that is the best way to connect with a congressional office and congressional staff. And many of you are probably experienced in doing advocacy, and in your experience, I'm sure you've seen that. Hey, by the way, Paul, I have New York State roots in that I spent 3 years in Rochester, New York, in the last part of my heart surgery training. So,
Oh, good.
So I kind of...
I knew there was something great emanating.
But I went back to Louisiana after that. But, I was a second-year surgical resident, married a couple of years, 3 years. I was working that day, and I got a frantic call from my wife. Her father was a lawyer in a small town in Louisiana, and he had just been shot and murdered, and then the individual committed suicide afterwards. We had an 18-month-old son, and I remember I was driving from New Orleans the 180 miles or so to meet my wife and my son, and with her family, to be with them during that just incredible tragedy, which was devastating for us. She was an only daughter. He was not only my father-in-law, but a really close personal friend and advisor, confidant. And it was we live with that even today. And, and all of us have had experiences in some form or fashion with mental health crises and problems. I'm so happy right now in my post-congressional time to be able to work with the American Psychiatric Association on a whole range of these mental health issues, because this is a crisis in this country today. It's a crisis affecting veterans with PTSD and suicide and substance abuse. It's a crisis for those who have been affected by suicide. It's a crisis for the many who are suffering from substance abuse. What do we do about it? It seems like an overwhelming, complicated problem. Well, we need to bring transparency and accountability to the whole operation around mental health. And I think one of the best ways to do it right now, looking at the circumstances and where we find ourselves, is to look at how do we really, truly, finally bring about mental health parity in our healthcare system. And we have an opportunity now. We have bipartisan legislation that has been introduced in the Senate, and we worked hard over the last few months to get Senators Murphy and Cassidy to come together on parity legislation to ensure that we get compliance and move that bar forward to get to a real situation where there's mental health parity. And it's imminent now. It's just a scheduling issue from last week. We'll have a companion bill introduced in the House by Representatives Porter, Bilirakis, and Norcross. These bills have bipartisan support.
Katie Porter's from California, right, and Gus is from Florida.
Florida, right.
And Norcross is from Jersey.
Jersey. Yeah. So we have an opportunity. The Senate bill is S-1737. I would ask you to pay attention to it, offer support for it. We think there's an opportunity now that the bill's introduced, and Senator Alexander is going to move health care legislation in his committee in the Senate sometime, I think, in July. We believe, according to what we're hearing from the two Senate offices who are primary on this, that this legislation may be included in that bill.
Great.
And that will be bipartisan health legislation. It could be perhaps one of the few things that actually gets done this year, and certainly in the health space.
Excellent.
So we need your help to keep that in mind, because it will help you in your cause as well.
Well, know that Senator Cassidy and Murphy's bill's on our ask list.
Good.
And then we will make sure that Congresswoman Porter and Bilirakis know of our support. And both of you are familiar with what happened on the 21st Century Cures. So
right,
a lot of different bills, including the Murphy-Cassidy mental health reform. And Paul, you helped on the House side get that all squared away. So why don't you chat for a minute about your bill? You have many bills, but one we wanted to focus on today was H.R. 2482, which is the Mainstreaming Addiction Treatment Act of 2019.
Right. Thanks, John. Again, one of the reasons to run for Congress for me was to make certain that we have effective programs, that there's access and affordability for those who struggle with mental illness and mental health disorders, and the further ripple effect out into suicide and all sorts of dynamics that destroy individuals and families. Wanted to make certain that we're doing the best we can in the middle of this opioid epidemic. And from my visits with those who struggle with the illness of addiction, stated very clearly to me from those who are there living it, that when they have their moment of clarity, they need treatment on demand. And when we're addressing 1 in 5 of us who struggles with that illness, that is simply not good enough. 4 of 5, therefore, 80% of individuals in this country who walk that walk daily were not having their needs met. So what we did over the course of 2 Congresses is address greater amounts of treatment, greater access to treatment. Last year, we addressed the issue by looking at that 100 patient threshold per medical doctor. This science is now some 20 years old, so there's plenty of history and data compilation so that it can instruct us. We felt it was time to readdress the cap, and so it got moved to 275 patients, which does a lot per doctor to make certain that we're reaching to the vulnerable. And then we thought it's also possible to add disciplines like nurse practitioners and physician's assistants and various specialties within nursing with the appropriate training and certification to be able to broaden the service provider audience. That with the amount of certification being done, and I think increases by multiple measure the amount of service availability to those who are, again, living with the illness. We then realized that we wanted to go further because as you continue to explore, you find that there's a bureaucratic hiccup along the way where if you're licensed, trained and licensed as a professional to be able to provide for prescription of buprenorphine, for instance, for pain management, you still need to go through a hoop at DEA. And it's a bureaucratic struggle for many to accomplish that, and therefore you're denying, again, service from those who are expertly trained and professionally ready. So our bill undoes that jumping through the hoop, so to speak, and it would allow, through the medication-assisted treatment phenomenon that they can dispense, allows them to then serve the general public there. Look, when you see items like 63,000 deaths from opioid overdose in 2016, when you see that climb to 70,000 in 2017, and many have suggested the 2018 data, which are not yet available, will perhaps exceed 80,000, you know you have a crisis. If we had that many people struggling from an illness, say diabetes, if they were denied insulin, we would have riots in the street. People would say, this is a mass crisis that we need to address. And so we want to approach it that way. Look, if this is indeed a crisis, and I believe it is, you believe it is, let's act accordingly, and let's provide for the treatment that is essential. You know, a lot of struggle to get to those points. We had a lot of efforts made in the House to get this onto the agenda with Energy and Commerce, but we were determined, because of your passion that we share, to get it done. And we made that first step complete, and now with 2482, HR 2482, we're hoping in a bipartisan way with now 43, I think 44 by tomorrow morning, sponsors in a bipartisan listing that we'll be able to go forward with this. Many papers across the country have opined favorably. We saw some in Baltimore, we saw some in Philadelphia. I see it in the 20th Congressional District in the Albany, New York area. People are standing up saying this is a common sense thing to do. And again, if it can save lives, why don't we rush forward and get this done? So we won't be satisfied until we get this across
hopefully
the
after tomorrow's visits to all the House offices, we can get that co-sponsorship.
Oh, we would appreciate that immensely.
And really get things moving. Charles, back to the Senate bill. So is my understanding correct that the Cassidy-Murphy bill would ask for the collection of data around how insurance companies actually pay for mental health services so that they can quantify exactly what states or which insurance companies are complying with the mental health parity law and which are not, which would set the stage for future action?
Absolutely. What it does is it provides for comparative analysis among plans to look at what's being done on medical, surgical versus mental health. And it provides for a situation where there's a complaint filed, then there's an opportunity for the different agencies to look into that complaint and investigate, but it also creates a mechanism for a sort of a random audit of 50 plans each year to start to look at what's going on, where we have these deficiencies. Sometimes there's compliance because the personnel aren't there. You just don't have the mental health care personnel to do the work there. We need to understand, we need transparency, we need accountability so that we're taking steps steps to ensure that we have a pretty seamless mental health care across the country, along with treatment of physical disease. This is critical in my mind. We won't solve the problem until we at least have an understanding of what's contributing to
What's the lay of the land?
This lay of the land and the disparity that exists.
Excellent, excellent.
If I can just jump in and say, when I came here, having implemented parity in New York, and knowing that the federal thing was going through the promulgation of rules and regs and rules to guide that through the process, we enjoyed our role as watchdog, watching from the legislative perspective as to how the rules were developed and how in keeping or in not keeping, whatever the case may be, to the letter and spirit of the law, the outcome might be. Because it's oftentimes we can address things at Congress, at the congressional level, and then you have people, not really implementing it to the fullest extent. And for me, this needs to be across the board, just aggressive to make certain that every opportunity for fairness is achieved here. I think it's so essential. I talked to a dad about a year ago whose son is incarcerated along with his daughter-in-law with the illness of addiction. He is a custodial. He and his wife are custodial grandparents. And he was telling his tough story to a buddy, a real good friend, and mentioned that, it had really impacted the family along with the two individuals incarcerated, and mentioned why, talked about, how the funds were depleted, that it wasn't the most honorable outcome. But it's the nature of addiction, right? The gentleman, the friend, looked at his buddy and said, "Boy, am I glad my son's a good kid." When you hear that, you get so disgusted that we're going to character assassinate because we don't commit the funds. We want cheaper government, smaller government. We get what we asked for. A budget is our priorities. Don't tell me we're going to reduce the size of government and then allow something like that to happen. As I said in my initial comments about Timothy O'Clair, I have learned to say completed suicide, not committed. His parents said if anybody committed a wrong here, it was government not putting the bills together, the laws together that guarantee equal access, equal opportunity, a justified, dignified approach to health care. All I see this as doing is inserting hope into an equation at times that is rendered hopeless and undignified. And we can't rest until we bring dignity to the equation and hope to the fabric of communities. I think it's so absolutely important.
Paul, I have to say that at the state level, a lot of work's been done, and one of the reasons we've been able to get this breakthrough with the Cassidy-Murphy legislation is because a number of states have enacted very similar legislation in a bipartisan way. This is something where both parties need to come together. Mental health and all the problems that ensue as a result of it, that's not a political issue. It's a human issue. It's a compassion issue, and it needs to be addressed. So I applaud you for the work you did at the state legislative level in this area, because it's certainly helped to lay the groundwork at the federal level to get something more.
Well, I wanted to
done.
also, you've got some of the best staff people. Tim is one of the great guy, and then Jeff that works for Paul. So, and Charles also, our relationship with APA is wide and deep, and your former president is a member of our scientific council. So again, I think the future for us is all of us working together. If we work 24/7, we can't get the job done. So what does your group do well? What does your group do well? And then if there are holes, what do we do? Back to the Murphy-Cassidy bill, I think it's critical, obviously, that we had a presentation this morning on medical research. And in our world, a lot of our education programs, or all of our education programs, are evidence-based. So we have to collect the data. So I think it's critical critically important that, again, we try to get beyond the emotional baggage of the Affordable Care Act and what coulda, shoulda, might have been, and start focusing on facts and information so that states can go to insurers. The other good news this morning, Kaiser Permanente announced from this stage that they were making a sizable financial contribution as well as an organizational contribution to the Mental Health for Us campaign. So I think
That's
things
superb. Yeah.
are changing. So I want to shift gears a little bit. And remember, you've got index cards, so please write your questions down. If our interns could pick up the index cards. Let's focus. Half the people in this room, how many people have lobbied on Capitol Hill before? Okay, so that, and then how many of you are brand new and this is your first time visiting Washington? So on purpose, we try to bring in new recruits each year, but also have our veterans, meaning they've been to a previous forum. So both of you have hardworking staffs. I would believe I've been in D.C. for 42 years. I came here as a young lad, worked for a senator.
He still looks pretty young.
From Indiana, and I was just so enthralled. I still am, and I think people ask me what's the greatest challenge for me and my team, and it's not to become cynical. There are some bad eggs on, let's admit, on both sides of the aisle, but both of you have hardworking, you had a hardworking staff, you had a hardworking staff. What's the best way for our people to use the 15 minutes or a half hour they're going to get with either a really smart, young, intelligent, overworked legislative assistant, or perhaps if they're from the western states, like our Alaska people normally meet with the members directly, Montana, Idaho, but just share some fun, thoughtful, and don't you think people have to be themselves? That your staffs are people too. Ask, how's your day going? You know, we know you're having a busy day. Thank you so much for taking time out. And if you can't meet with a member, the staff, like Jeff, are sometimes better. Not that you're bad, but he's more in tune.
Oh, he's very good.
So anyway, so take it away.
You know, it's interesting. When people tell their story, there's nothing more powerful. People have shared with me how long their loved one struggled with either mental illness or addiction as a disease. They go through all the painful moments, and role models for me today are those people in the recovery community. I can't imagine what courage and determination and fortitude goes through those efforts, but absolutely powerful people, and been working on efforts to make certain that people in recovery are given opportunities to work. I said, look, you not only get a good worker, you get a structured soul, because these programs have reformatted. You hit restart, and you get a huge, vastly improved, probably better at that than we so-called normals are, right? So I think you need to exchange that, how it's made a difference, how it helps. Had a neighbor who died from addiction, who left 3 children and a widow. The parents will tell you that the family on both sides just took him to every clinic. We need to hear that. We need to hear that, because it's not a program. It's not an appropriation. It's not a dollar amount. It's a life, a human life that is begging for help, and it needs to be veiled in a sense of urgency and justice. I just think the injustices we've allowed to happen is totally unacceptable and un-American. And then, well, let me back it up. When you walk into that office, my office, formerly into the congressman's office, just do some sort of trite, nice thing, right? Like, hey, thank you for sponsoring so-and-so bill, or anything on any topic, because this is all about relationship building.
Right.
So throw some sweetness out. And because you know there might be some unsweet thing coming, right? And you just advocate for the bills, again, with the personal stories. But then that closing deal. I mean, if somebody comes to me and said, you know, where are you on programs that address domestic violence, or where are you on access to health care? I mean, I'd be a fool to say I don't support it. I support it. Ask us if you're willing to put your neck on the line and come up with the resources to make it happen, because that's where the rubber meets the road. And you need to get that commitment. And then just let them know you'll be following up on this topic. But we need to commit. You know, I will tell people all the time, I love all these people who just want to reduce government but don't want to address programs, and then they put, oh, I like that. Well, no. Show me how much you like it by being there. And if some cuts are painful, as we did in the billions for mental health, where we've not addressed the childhood population with mental health, call us, take us to task on it, because we need to commit to the absolute energy that is required to put these dollars into appropriation bills, or to reinforce the revenues that are essential to make it happen. Some people love to have it both ways, you know, stir the magic wand, and I'm reducing government, but guess what? All your programs are going to be met with what dollars? You know, if that makes me a bleeding heart liberal, tough. Because, you know, politics is in my blood, and the last time I checked, that blood flows through my heart, and I'm not ashamed of it.
Well, Charles.
Paul is
So you served 7 terms, like 14 years, right?
6 terms.
6 terms, 12 years, okay. So you were on the Hill for 12 years. You're now still in D.C. So again, share some of your thoughts about having been there and now looking forward.
Paul gave you tremendous advice, and I when asked that same question, I always mention, tell your stories. Personal stories matter, and especially in healthcare. No one, you can take the most rock-ribbed, hardcore conservative, and they're going to listen to a story of hardship and heartbreak. So tell the stories. Secondly, when you go into the office, and especially for those of you who are just getting started, all the staff in that office are important. Get to know the scheduler. The scheduler is important. She made the meeting happen, he made the meeting happen. And that's the person who will get you subsequent meetings.
Right.
Get to know the health staff, the legislative director, the chief of staff. Make a personal impression, because relationships matter. And then ask for the name of the district director back home. Because oftentimes when a member of Congress is going back to their district, or a senator is going back to their state, and the schedule's being made as to where they're going to go and who they're going to visit, well, guess what? That district director has a lot of input back into the D.C. staff about setting up the schedule. So those are just a few little hints and tips about building relationships, because in 15 minutes in an office, if you're lucky to get that, because they may get interrupted by votes or some other issue, use that time wisely to make your impression with the story, but also get information about who these other staff are. Send them a thank you note.
Right.
But maintain that connection.
Does snail mail still work? I know it takes a little bit longer to get there,
It
but
does.
it's
I'd
nice
use all
to
of it.
still get something.
People still appreciate a handwritten thank you note.
Good.
They go a long way.
So, Charles, you may know that we now have 450 community walks across the country.
Nice.
So isn't that an extra? Paul has been to the one in New York for 12, 13 years now.
Might have been our 14th year this year, and I watched it start at, I believe, 125 people, and I think 1,400 people showed at the last one, and with a very powerful pre-walk ceremony that is unbelievably
So to your point, a district director would welcome welcome an opportunity to get an invitation for their boss to come speak
Absolutely.
about the broad issue. There's no fundraising. All of our people, most of our money's raised at the state and local level. Each of the chapters get to keep about half of what they raise to spend locally. We don't ask for any government funding. I've told the boss over there, he's looking at me right now, that if you ever ask me to go to the Hill and try to get government funding, we don't want it, because we want to be free to be able to say to Congress and to the White House and to the agencies that the only dog we have in this race is the best, the brightest, best evidence, and how can we help get the word out. And all of these people represent part of the solution that we as an organization believe it's not just the federal government's role. They have a role. It's not just the state government's role. They have a role. It's all of us working together inside and outside government.
I had even talked to Nicole before the programs today and thanked her for the work she's doing in organizing in the capital region of New York and upstate New York. More campuses are coming forward. SUNY Albany, Skidmore. So, the young adults are understanding that this was stepchilded in terms of policy and resource advocacy, and that advocates are not going to take it any longer, and that this up-and-coming generation knows what's fair and what's right, and they're going to get it done. So, just reach out to those campuses, too. It's great. And Joanne knows, right? We just advocate real well in the capital region. Thank you. So, and I just want to add to Charles' comment about the staffing issue. Think of it, for many of us, we have a couple of people dealing with all of the plethora of issues that come our way. So they almost become more entrenched in the issues than we can, because we're asked to know a whole lot or a whole little about a whole lot of issues, whatever it is. But I rely on my staff tremendously, and they get to network when I'm not here, so they're working on this stuff when I'm at home, meeting with individuals who couldn't join in a fly-in. So you make it all work. But the point of the matter is, don't reject any of the brain power that can make this happen. Speaking of the brain, we need to advance from 21st Century Cures Act. We need to really advance research on the brain. With the intellectual capacity of this country, shame on us for not doing more neck-up research, which I think is so important, and the least researched organ of the body. And when you think of Alzheimer's and what the effect is on the federal budget and the painful extraction, again, of onto families, genomic discovery that can come with brain research can cover a number of things, not just addiction and mental illness, but a whole sort of neurologically based diseases. So let's just put our priorities out there and say, this is us. This budget will reflect who we are, what we believe, what we cherish. And for far too long, people have been asked to live in substandard situations because we didn't make the commitment, and I just think it's
We have a question here from the audience. How do we, as a disease group, meaning mental health and suicide prevention, how do we compete without talking down about the funding levels for cancer, the funding levels for Alzheimer's, the funding level for diabetes? Bob, I used to call him and say, well, Bob, I'm going to go into the office and they're going to ask me, well, how are you going to pay for it? And Bob said, well, can't you tell them just that's their job? And so I guess, how do we compete aggressively without looking like we want the other disease to lose? Because this should not be a win or lose situation. Does that make sense?
It makes total sense. And, leave that to us. We need to get this done. But make your case, again, for the appropriateness of the funding. And even offer backup, reinforcement about what the economic multiplier might be with some of these programs. And of course, just the plain old dignity factor. Like, this is something that needs to be done. There's a cure that can be attached to this situation, and shame on us for not getting it done. And let us sort through those priorities. But if we hear from you in a very passionate way, with, again, powerful anecdotal evidence, then then it's up to us to put together the right budget. And if we shortchange people, hopefully when we get our report card, it will be F's down the aisle and won't be returned to office, because people need to be engaged and say, hey, this is a priority. You knew why. It was with all the documentation and the humanism that connects us all in a common format. How did you walk away from this? And let us suffer the consequences rather than the mentally ill.
When a gun shooting occurs in a movie theater in a small town, it affects the entire town, and not just for a few days or a few weeks. It affects the psyche of the town for a long time. When floods strike the Midwest and farmers lose their property and small towns along the rivers are flooded, there's an epidemic of mental health problems that ensue and follow. We're at a crisis level with this. And I think members of Congress now perceive that that's the case. What week goes by when we don't hear on the news or read about in the news some shooting in a community? And I think my Republican colleagues, oftentimes who are inclined to maybe put this as a secondary issue to maybe funding for cancer or for heart disease, I think have now awakened to the fact that we have a problem. So the key now is to continue to really push the advocacy and make the case. Mental health affects a broader population because of the impact it has, especially when it's associated with violence and substance abuse. There's not a single mayor in this country who is not struggling with what to do with the mental health crisis in large cities and small.
Right.
Which is why Paul's...
And it has a broad economic impact for those who care about those issues. This is a fundamental problem that's it's a cancer in the root of our society that we have to treat. And so don't put it in terms of competing against one disease versus another. Lay it out as a priority and show that connectivity, how it helps solve so many other bigger problems that are out there that are so intractable now. But it starts with solving mental health concerns. And so I think that's the way I would approach it.
You know, I find the question, the way it's presented, very interesting. It's reminding me as we sit here and speak that it's almost like characterizing block granting, which is a cowardly way out of choices. What do? We take community drug awareness programs and we take some other block area and we put them in a block grant. So we pit good program against good and say, solve it. Oh, we didn't cut the programs. We say put them in a block grant. Baloney. You cut the programs. And so a lot of attempts these days is block grant. And I think that is a cowardly way out of a situation where we need to advance priorities and stand up for what you believe and what we believe. And if we commit to you in these meetings, follow through, because follow through is very important. And block grants, I hear right in that question. That's how we've come up with the concept of block grants. Well, we didn't cut your program. We put it all into, and sometimes we cleverly the system cleverly puts a number of programs into a block grant and keeps it holistic, keeps the funding intact, and then sneak attack down the road 2-3 years later, start cutting the block grant funding after the attention to that exercise has been somewhat blurred. So it's all about prioritization. And, and if we don't have the revenues, that's our job too. Produce the revenues. And if you're going to do certain tax cuts and we couldn't afford them, don't do them.
If we allow people to recover and to deal with either their substance use disorder or alcohol use disorder and get to a new normal, then they're able to go back to work, pay taxes,
Absolutely.
And it's a benefit to all of us, but it's really hard. I mean, Patrick Kennedy this morning spoke about you remember when he woke up at 3 o'clock in the morning and that for him was his Waterloo.
Right.
But then he had to come to terms with what's going on, and I think the Congress here, I was in the cancer control movement with the American Cancer Society in the 80s, so I remember in the 60s as a child, you didn't really talk about cancer.
Right.
And then in the 70s and 80s, you really didn't talk about AIDS. And let's be honest, that you really haven't talked about Alzheimer's in any meaningful way until the last 10 years. So I think our area is perhaps one of the last public health crises that's being dealt with.
And it's common sense, too. I'll take your scenario that you just shared with getting somebody back to work. How about pumping it back to the very early stages of life, when we don't do funding for mental health programs for children? And many of our children are requiring that funding. So through a lifetime, that child will probably become dependent on some sort of government assistance, and they'll be targeted, they'll be blamed for our budget woes, when in fact we should be blamed for not being there to do the preventative therapy that could have existed. You know, I also have a bill that I'm doing, 1329, is it? HR 1329? Is that right, Jeff? Okay. I'm pretty good at math, but sometimes I don't get all the numbers right. But it's a Medicaid Reentry Act. And we are taught by data. Data are very convincing, saying after you're released from an incarcerated setting, which happens to many of our loved ones who struggle with the illness of addiction, you're 129% more likely to die of a drug overdose within 15 days. So put on your thinking cap and get something done. So let's start medication-assisted treatment or some sort of programming 30 days before the release date. If you're Medicaid eligible, which many of our loved ones are because of the nature of the disease, start it up. Science tells us physiologically these lives have been readjusted because they're removed from their substance dependency. But they're going to be placed back into perhaps the same setting. Or 5,000 jails in the country, and maybe 40 of the 5,000 jails have a medication-assisted treatment that's going on. So we're not giving them services, we're warehousing them. What's that say? Punishment will solve your illness. Really? So we know the facts. Let's make them work. Let's put them into policy format. So we're hoping to get our bill passed where every state would be required to provide medication-assisted treatment if you're Medicaid eligible and avoid this loss of life, because I think it's that important. Charles?
You know, after spending a lot of time in Congress working on a lot of legislation, let me give you a little hint or tip about how to move your issue to a priority level. There are a lot of good bills and things that get introduced in Congress that will solve problems, but they may never see the light of the day because they haven't reached a priority level up the chain with the leadership, the committee chairman, leadership, and so forth, to be seen as something that has to be done. And one of the biggest problems I've seen in healthcare, whether it's mental health or the physical health side with the different advocacy groups, is when they all start competing against each other. Because then what happens is, okay, well, in healthcare, these groups, they're all on different sides of an issue. Congress is not going to want to get involved in it, and nothing gets done. So from the standpoint of mental health, you know, getting parity is important, and you know, I'm obviously putting a lot of time in that effort working with APA, but let me just say this. You have to build coalitions and to build momentum to raise these issues to a top priority. If you go in and ask for a whole bunch of different things, then that's a recipe for Congress to divide and conquer and nothing gets done. So you have to sequence things right. You have to set your priorities and then build as big a coalition as possible around it to demand a change. And I think there's a tremendous opportunity right now because of all the violence in schools and everything else. It's really raised Congress and the executive branch attention with regard to the mental health issue. So the key now is to figure out what are the priorities that you have, and then building coalition, as broad a coalition around it as possible to really drive this in the halls of Congress. And that's how you raise it to a level of priority so that you can actually get it passed into law. Excellent,
excellent. Okay, well, I think we're going to wrap things up. Thank you for your past service and your future service. We look forward to working with the APA.
Good going, Charles. Good work. Thank you for
Enjoy doing
fight going.
And Paul, again, we look forward to working with you, and I truly think that mental health and suicide prevention is becoming more and more nonpartisan, especially, again, when we had Senator Cassidy and Senator Murphy on this stage 3 years ago, and Chris said, how does a progressive Connecticut Democrat work with a conservative physician from Louisiana? And they said, it's really easy. They sat down, they talked about the issue, and they transcended what might be perceived to be differences, and they came together and they got things.
Just share this one final note before we close down on our 2482 legislation, our second stage of getting rid of the loopholes in the bureaucracy, DEA. We have a member of the Freedom Caucus as a co-sponsor and the chairman of the Progressive Caucus. And I'm saying, wow, now there's some strange marriage that we can put together. So we feel really proud of that. We're saying, hey, we're reaching a broad, diverse audience, and that's us. We're in this together. So we can weed through those common strands, but there are certain issues of justice and fairness and dignity in life and saving lives. Those things unite us, and let's get this done. And so I wish you well. Don't let us wiggle out of any tough moments. Build a good relationship. Throw the sweet out there, but do not make us commit. That's important.
You jogged my memory. 2 years ago on this stage, Karl Rove, who lost his mother to suicide and was George Bush, the son's political brain, and David Axelrod, who was Barack Obama's political brain, lost his dad, who was a psychologist, to suicide. And they, again, transcended. You couldn't hear a pin drop in the room, or you could hear a pin drop in the room, because they really articulated what was going on. So to have two gladiators like that come to the table, I think those are the kinds of messages which I think could help with the country, that we need to get back to what most of us agree on issues, and it's just a couple issues that we don't agree on, and let's not focus on that. And
well, this is one that does unite. There's no question about it. So I applaud you for all the work that you're doing. It's hard work doing this advocacy, but keep it up. The timing is really good. And for my Republican friends who oftentimes show up on television after a terrible, tragic incident at a school or something like that, and they're out there saying, oh, it's not a gun problem, it's a mental health problem. Well, there's something called accountability. What are you going to do about that mental health problem? What are you going to do about it?
let's give them a hand.
Thanks, everybody. Thank you, everyone. Thanks.
Thanks, sir. We look forward to working with you.
I love my New York crew. They're awesome. Yeah, Charles. Good to be with you.
Keep up the great work, man.
Thank you. Thank you.
Thank you, guys.